Today we are going to do multiple choice questions. Okay, so the first question is where is stippling seen? So the options are marginal gingiva. So this is the marginal gingiva. The second option is your attached gingiva. Third option is your interdental papilla, and the fourth option is your none of these. So what will be the answer? The answer will be attached gingiva. Why is stippling present on the attached gingiva? Where else is stippling present? Stippling is also present in the center of the interdental papilla. Okay, so stippling is present on the center of interdental papilla and the attached gingiva. Why? Because see, the attached gingiva is attached to what? It is attached to the periosteum. So there are basically some microscopic protuberances and depressions. So these protuberances and depressions that are present, they cause the stippling. Now stippling is absent in infants, and as the age increases it reduces. Thus it may be absent in old people. And at what age does stippling appear? Stippling appears at 5 years of age. Okay, so basically stippling is an adaptive specialization wherein there are protuberances, elevations and depressions in the gingival surface which is visible, and stippling is also known as orange peel appearance. Okay. So coming to our next question, the color of the gingiva. This is an important thing. Color of gingiva. So what all is the color of the gingiva dependent on? So color of the gingiva is dependent on your capillaries. First option. Second option, thickness of epithelium. Third option, thickness of keratinization. Fourth option, pigmentation. So the answer is all of these. So your color of gingiva depends on 4 things. The first thing is the blood supply. The second thing is the thickness of the epithelium. So if this is your epithelium, the thickness of the epithelium will determine the color of the gingiva. Now supposing I take this and it's only 1 stroke thick, the color of the gingiva increases this way. So you can imagine if there are layers, then that's how the color of the gingiva also changes. Third is keratinization. Yes, keratinization, the more number of cells, the more better the color of the gingiva will be. And last of all is pigmentation. Of course, if there is pigment, then the color of the gingiva will be present. So it depends on all four things. Third question. The free gingival groove. Free gingival groove. So the options are, what does this represent? So this, what does it represent? Does it represent the histologic depth of the gingival sulcus? Second option is the false pocket depth. Third option is depth of the gingival sulcus. And the fourth option is none. So in this case, this can be quite confusing, because they have mentioned histologic depth of the gingival sulcus, and over here they have written the depth of gingival sulcus. And so basically, free gingival groove, it represents the histologic depth. It is the exact place where there is a depression. The free gingival groove is where there is a depression. Okay, so this area, and it demarcates the histologic depth of the gingival sulcus, the exact position where the sulcus gets attached onto the cemento-enamel junction. So this is the answer. This is the correct answer. The false pocket depth is a confusing one. False pocket depth is not the answer. Depth of gingival sulcus is also not exactly the correct answer. The exact answer is histologic depth. Okay. Another question on stippling. So stippling is absent in 1. infants, 2. older men, 3. children, and 4. both 1 and 2. So obviously the answer will be both 1 and 2, which we have already discussed. Stippling begins from 5 years of age, and as we grow older, the stippling gradually